Hello students, welcome back to another learning lessons in our Physio-Pulse channels. In today's lectures, we will discuss about the diuretics in a simple, conceptual and exam-oriented manner, especially designed for undergraduate students, even also those who are interested in diuretics. So, in this chapters, we will discuss about one by one introductions, the general uses of diuretics, abuse and complications of diuretics, and the different types of diuretics which are used. Uh, all we will discuss in a simple and exam-oriented manner. Now let us see first introductions what of the diuretics. So what is diuretics? Diuretics is the diuretics or diuretic agents are the substances which are enhances the urine formation and output. When these substances increase the excretion of water, sodium as well as chloride through the urine. So diuretics agents increases the urine formations by influencing any process involved in urine formations. So they are called the water pills. Sometimes diuretics are called commonly water pills. So now let us understand about the general uses of diuretics. Diuretics are generally used in the treatment of disorders involving increasing the extracellular fluid volume like the hypertension, congestive heart failure or cardiac failure, and even edema. Diuretics agents prevent the hypertension, congestive cardiac failure, heart failure, or edema by increasing the urinary output, even also reducing the ECF volume, extracellular fluid volume. Now to see the abuse and complication of diuretics. Nowadays, diuretics are misused in order to reduce the body weight and keep the body slim. So even persons who are suffering from the eating disorders attempt to reduce the body weight by misuse of these diuretics. However, prolonged use of these substances leads to complications like the syndrome diuretic dependent sodium retention, and which is characterized by the edema. So the adverse effects of the diuretics are the dehydration, electrolyte imbalances, potassium deficiency, headache, dizziness, renal damage, cardiac arrhythmia, and heart palpitations. So all these are the adverse effects of the diuretics. Now to see the types of diuretics, there are various types of diuretics. Specifically, we are classified as in 7 types. One is osmotic diuretics. Second, diuretics which inhibit the active reabsorption of electrolytes. Third, diuretics which is inhibit the action of the aldosterone. Even diuretics inhibit the active carbonic anhydrase enzymes. Number fifth, diuretics which increases the GFR rate. Diuretics which inhibit the secretion of ADH, and diuretics which inhibit the ADH receptors. So one by one we will discuss here. First of all, osmotic diuretics. What is the meaning of osmotic diuretics? The term osmotic diuretics are the substances that induce the osmotic diuresis. That means osmotic diuresis is the type of diuresis that occurs because of increased osmotic pressure. Some of the smaller osmotically active substances are not reabsorbed from the renal tubule, and when injected in large quantity into the body, these substances increase the osmotic pressure in the tubular fluid. So increased osmotic pressure in the tubular fluid in turn reduces the water reabsorption. So it leads to excretion of excess water to the urine. So the example of this type of diuretic are the urea, mannitol, sucrose, and even also glucose. Number two diuretics is which inhibits active transports of electrolytes in PCT or proximal part of the distal converted BCT. And this type of diuretics are called the thiazide or related diuretics. And like the chlorothiazide, metlazone, and chlorphenidone, there's all of the example of this type of diuretics which can inhibit the active transport of electrolyte in the proximal part of DCT. Number three, diuretics which inhibit the active transport of electrolyte in the distal part of the distal converted tubule. Some of the diuretics which inhibit the reabsorption of sodium and excretion of potassium ion in distal portion of the distal converted tubule, and even also collecting duct or collecting tubule. Such substances are potassium retaining diuretics or potassium sparing diuretics. So they are called the trimetine or even also amiloride. These are examples of this type of diuretic, those who are in the distal part of the distal converted tubule. Now, diuretics which inhibits the action of aldosterone. What are these things? Some of the important diuretics, they are inhibit the sodium reabsorption and potassium excretion in the DCT and collecting tubule. And by inhibiting the action of aldosterone, and these substances are also called the aldosterone antagonist. And for example, these are the spironolactone and epidemiolone. So this is called the diuretics which are inhibit the action of aldosterone. Now, we'll discuss about the diuretics which can inhibit the activity of the carbonic anhydrase. Some of the diuretics which inhibit the activity of carbonic anhydrase in proximal convoluted tubule and prevent the reabsorption of bicarbonate ions from the renal tubules. So resulting in osmotic diuresis, and such diuretic agents are called the carbonic anhydrase inhibitors. Like the acetazolamide is the carbonic anhydrase inhibitors. And diuretics which increase the glomerular filtration rates, that is the alkaloids used in mild stimulant as a result causes the diuresis by increasing the glomerular filtration rate and some extent by decreasing the sodium reabsorption part. And like the caffeine, these are example of this type. Now, another important diuretics which inhibit the secretion of antidiuretic hormones, like some ADH hormone, some diuretics produces the diuresis by inhibiting the ADH, because we know that ADH has the main important function to retention of the water, even also sodium and chloride. So therefore, it can inhibit the ADH hormones, and in this way, it can inhibit increases the diuresis process. Example of ethanol in water molecules. And last but not the least, that is diuretics, which inhibit the antidiuretic hormone receptors. The antagonist of the V2 receptors causes the diuresis by inhibiting the receptors of antidiuretic hormone, thereby preventing the activity of this hormone. So in this way, we have discussed all different types of the diuretics. Even in these lectures, we have also completed the definition of diuretics and what are the general uses of diuretics and use and abuse of the complete abuse and complication of diuretics and some adverse effects of diuretics. So students, I think this is actually what you learned from the textbooks. This everything is given here. And thank you for watching this lecture. I hope this session has helped you to understand the topic clearly. And if you found this video very useful and helpful, please like, share, and subscribe to our Physio-Pulse channels. Do not forget to press the notification bell so you never miss our upcoming lecture like physiology, biochemistry, and biology. If you have any question, any query, any suggestion, please give some write in our comment box or comment section. And thank you, and we'll see you in the next lecture. Until then, keep learning and stay curious. Thank you.